Hi, and welcome to the podcast, Help Me Rhonda. I'm your host, Dr. Rhonda Karg. I'm a clinical psychologist. In each episode, I share mental health related information with you. And today we're going to be talking about 10 tips to reduce your anxiety in your mind and in your body. So, the first thing that I recommend that you do is appreciate the utility of your anxiety. And the utility of it is that it is meant to protect you. It's a fight or flight response. And so recognize the utility of it and even demonstrate gratitude for its efforts to protect you and keep you safe. And be able to just sit with that anxiety and hold space for it, tolerate it, and just allow yourself to feel it for a few moments, okay? I think that that is a really good way to de-escalate anxiety, is to use my body double and just validate how you're feeling and express gratitude to that part of you, okay? The second thing that I would recommend that you do is learn what the red flags for anxiety are for you. So for some people, it's tension in their jaw or in their neck or their shoulders. Some people, they often even feel that their fists are clenching and tense. That's a red flag that you're anxious and aroused or activated. There are also cognitive red flags that you're anxious. If you're engaging in catastrophic, like worst case scenario thinking, that's a red flag that you're anxious. Also, you can look at your behaviors sometimes and see that you're anxious. There might be certain behaviors that you engage in when you're particularly anxious. It might be certain vulnerabilities like picking your skin or engaging in substance abuse, things like that. So you can recognize what some of the behavioral indicators of your anxiety are as well. And along those lines, I recommend that you practice checking in with yourself, meaning that you scan your body. How are you feeling in your body? Any discomfort that you may recognize, any indicators of anxiety, physically, psychologically, emotionally, or behaviorally, but being able to check in with yourself and just see on a scale of 0 to 10, from 0 being no anxiety to 10 being a panic attack, where is my anxiety level in this moment, and just being mindful of that. And if you notice that your level of activation is, let's say, above a 4 or a 5, it's important to do something to calm your body down. And so you can use the five senses. The five senses, again, are taste, touch, smell, sound, and sight. So for sight, things that I enjoy are looking at pictures that I have of good memories from earlier times in my life. I like to watch time-lapse videos of plants growing, or watch videos of maybe baby animals or something like that. Can help me calm down and feel better. For smell, you can use essential oils. Things like lavender, sandalwood, lemon are all good for helping to improve your mood and calm you down. For touch, a lot of times people will touch a fuzzy blanket that's really comforting to them, or some people will pet animals if they have them, or getting in a hot shower can help reduce your anxiety. So using touch, using all of the senses to help calm your body down. And for taste, it might be some tea. You have to kind of be careful with that. You don't want to get into the bad habit of self-soothing with food that's not healthy for you, but using food that is nutritious, and using that maybe something fresh, or maybe some tea or something else that's pleasing to you can reduce your anxiety. Another skill for reducing your anxiety in your mind and body is something called thought stopping. And thought stopping is really a game changer. And I'm going to describe it a little bit today. And basically, what you do for thought stopping is you recognize that you're having a thought that's causing, let's say in this case, is causing anxiety for you or making your anxiety worse. You recognize that you're having that thought and you stop. You can see a stop sign or hear the word stop. Some people will put like a rubber band on their wrist and snap it. But the key to thought stopping is abruptly stopping it and then redirecting your mind to something else. The redirect is really where the rubber meets the road. Otherwise, you're just trying to push the thought down, and that's not going to work. That's going to make the thoughts come up more. So the key is to stop the thought and then redirect your mind to something else. My redirect is always, what have you got to do? I'll say to myself, girl, you don't have time to be sitting around worrying about this thing. You've got things to do. So I'll ask myself, what's the next right thing to do? And I'll go do that thing. Maybe it's put a load of laundry in the washer, or maybe unload the dishwasher, or maybe work on my billing. But there are always things that I can distract myself with. And it doesn't have to be a checklist of things that you need to do. I'm just describing what I use, and because there's always things that need to be done. So that's an easy go-to for me in terms of my distraction. Several years ago, I had major surgery, and it was about 2 weeks before my surgery. And one of the things that I needed to do to prepare for my surgery was to board my English bulldogs. And at the time, I had 3 English bulldogs. And the thought of being away from them was something that was really sad for me. And so I avoided thinking about it until one day I woke up and I thought, okay, today's the day. You're going to call the vet's office. You're going to see if they can take the dogs that week. I was nervous also about it because it was the week of Thanksgiving and I was concerned they were going to be filled. And so all this fear and anxiety led to avoidance until one day I woke up 2 days before my surgery and I thought, today's the day. You're going to call the vet and you're going to get them scheduled. And so I called the vet, talked to them. The girl that answered the phone said, yes, we can absolutely take them that week. We'll look forward to seeing you then. And I hang up the phone, and within about 5 seconds, my magical magnifying mind, as I called it, started catastrophic thinking. What happens if I die during the surgery? If I die during the surgery, no one will be there to pick up my dogs. And as a result of that, the vet's office will turn them loose. And as a result of that, my dogs will get hit in the street. And as a result, so I noticed myself doing that really quickly, and I thought, okay, that's crazy. That happened fast. It happened within 5 seconds of me being like proud of myself for having called and scheduled my dogs to go into the vet's office for boarding the week of my surgery. It went from that to catastrophic thinking. The next thing you know, not only am I going to die, my dogs are going to die tragically. Okay, so that's how quickly it can happen. So what did I do? I very quickly stopped, asked myself, what do I need to do today? I went and wrote a handwritten note to a patient of mine that I was really proud of, wrote them a note. After I got done with that, I had some other things that I needed to do to prepare someone that was going to be standing in my place with my patients during the week that I was out for surgery. So there were lots of things I needed to do to prepare for the surgery. So it wasn't hard to come up with things to distract myself with. And that's an example of thought stopping and how you can integrate thought stopping when you're having particularly anxious or catastrophic thoughts about a situation in your life. Thought stopping can really change your ability to cope with a stressor. Squared breathing is another way to calm your mind and body, and squared breathing is breathing in for 4 seconds, holding for 4 seconds, breathing out for 4 seconds, holding for 4 seconds, and then starting all over again with 4 seconds. Inhale, hold for 4 seconds, exhale for 4 seconds, hold for 4 seconds. So that's called squared breathing, and that can be really helpful to get you grounded and to calm your body down, to get you more below like a 4 or a 5. Moving your body is another thing that you can do. Moving your body is one of the best things that you can do for a lot of different mental health conditions, but it's something that a lot of people find really helpful in terms of burning off that adrenaline, is to move their body. And like, let's say going for a run, or maybe doing some light stretching or restorative yoga. You can do that to help you to calm down. But a lot of times moving your body in some way, kinesthetically, you can work through the anxiety that way. So moving your body is always a good recommendation for dealing with any sort of fear and anxiety or fight or flight response that you're having. Observe and describe. I've talked about this in some of my other podcasts. Observe and describe is a DBT skill. And what you do is you notice, you can do it for any of the 5 senses. So you notice what you see, what you hear, how things feel, how things taste, how they sound. And so using the 5 senses to describe in an objective way, what you're noticing. So for example, you might use observe and describe to observe and describe what you're eating, so you can notice the texture of the food, and you can notice what the food tastes like when you put it in your mouth and hold it, and maybe what it sounds like when you chew it, and how it feels when you swallow it, and what maybe flavors, aftertaste you have after you swallow it. So those are some ways that you can use observe and describe to help calm your body down. By using observe and describe, that releases serotonin in your brain, and research has shown that that can be very effective in terms of improving your mood and helping you to feel more calm. And lastly is what I call do it anyway, especially if you're avoiding something in your life because of your anxiety. Just do it anyway. Just do it anyway, because the avoidance leads to a lot of other problems. It doesn't solve anything. You're just avoiding the inevitable, which in turn creates more anxiety. So if you're avoiding things as a result of your anxiety, just do it anyway. Just do it anyway. Say that out loud to yourself. I know that you're anxious right now, but you're going to do it anyway. And go do that thing and just get it over with. Sometimes people find it helpful to count backwards from 5 to engage that part of your brain, that frontal cortex. Counting backwards from 5, 4, 3, 2, 1, and then practice that, okay? So counting backwards from 5, and then once you get to 1, just do it anyway, okay? That can help as well. So I shared 10 things today that you can use to reduce your anxiety in your mind and in your body. Hopefully you heard some things today that you can try, that you can practice at home and see if that helps out. I would love to hear your thoughts on whether or not you heard something today that you think is going to be beneficial to you, or you can comment on things that you heard today that sound familiar, that you've been using that have been helpful, but I would love to hear from you. Please like, subscribe, and share this YouTube channel with people to get the word out and to help reduce mental health stigma and to help improve people's mental health. So please like, share, and also comment to get more traffic. I really appreciate your participation in my channel. I hope that you have a good day.